The topic for the discussion is why recent advances. Can any one of you answer this question? Is it for a lot of knowledge? Is it for keeping abreast with the modern developments? Or is it to match and blend the recent advances with what we have got in our text? Why is recent advances important to us? I am a very simplistic and straightforward person. I take classes for the exam, and all my classes will be exam oriented based on the questions that have been asked. That having been said, you find that in today's curriculum for postgraduates, it has been very clearly demarcated. There are 4 papers for you people as recommended by the NMC. A general pathology, a systemic pathology, hematology, immunology and other laboratory pathology, and the 4th one is exclusively on recent advances. That means 25% of your theory paper is recent advances. You must be careful and have the common sense to understand that each one of the topic given in the various recent advances, be it hematology or histopathology or autopsy and whatnot, has been written by an expert or a group of experts who have done a lot of work in that particular field. For example, the undergraduate teaching, a class that I had taken just now. This has been taken by or dealt with by a person who has done a lot of work in it. It is not seemingly easy for us to master each and every topic of recent advances. Secondly, it will be time consuming. Third, the language will be difficult. Fourth, we are racing against time, fighting against shortage of time. Also, you find that the vocabulary is so very different that we will have to get used to it. And frankly speaking, I would say it's not worth it. You need not master each and every topic of the recent advances. Those years, the topics that we had read, for example, the theories of atherogenesis, early gastric cancer, were all topics in recent advances. But then, slowly they found space in the standard textbooks, including Robbins. So much so, we realized that if it is a topic in recent advance, my business is to answer it in the exam. And hence, we read it in Robbins, marked it as recent advances, and completed our task to some extent. But now I realize how futile and difficult an effort it is to read the recent advances. Hence, I am dedicating a lot of my time and energy for you people so that you listen to these topics. Even then, I would like you to prepare your own notes. Going back to the recent advances will not be a correct modus operandi. If the topic has not been covered by me, then definitely you shall go. Otherwise, your notes shall help you in the exam. And I, on my part, have derived all the information from the recent advances from the net and the other references. The pictures will be schematic, illustrative, and shall stay in our minds. So, recent advances is important because it forms 25% of the question paper. All the topics in recent advances have been incorporated into the text. Therefore, you shall be seeing it elsewhere in surgical pathology or systemic pathology or even general pathology. Apoptosis, for example, a topic in general pathology and also in recent advances. Electron microscopy, it has been mentioned as important, a topic in recent advances. Inflammatory bowel disease, a recent approach, topic in recent advances, and then it forms the chunk of gastrointestinal tract. And so on, it will go on. I would like you people to kindly go through the topics and benefit. That is why we will have to read the recent advances. After the exams, you may or may not remember, apply or not apply, incorporate or not. That is not my business. My business is for a student to clear the exam, and for that, recent advances will be mandatory. It is by experts in that field, not very easy for any of us to master. So, kindly benefit from the classes. Thank you.